Good afternoon, ladies and gentlemen. Our event will begin within 3 minutes. Please kindly take your seat and switch your mobile phones to silent mode. Thank you for your cooperation. Good afternoon, distinguished guests, speakers, and our dear participants. My name is Jessie from Taiwan Healthcare Youth Alliance. I'm honored to be your moderator for the first session of today's Global Health Diplomacy Forum. It's an honor and to gather here with the passionate professionals and advocates from all around the world, united by a shared vision for sustainable health and development. Our first session focusing on the theme, Achieving Sustainable Development Goals and Promoting Holistic Health, also about the innovative strategies to non-communicable diseases. First, we are really honored to welcome Dr. Betty Ya-Wen Chu to give us an opening speech. Dr. Betty Chu is a Deputy Director of Institute of Population Health Sciences at National Health Research Institutes in Taiwan. Let's give a big hand to Dr. Betty Chu.
Good afternoon, everyone. How are you today? Not hungry? Yet. Okay. So it's a great pleasure to be here today at this forum on non-communicable diseases and youth empowerment. The issues are very urgent and deeply connected with SDGs. In Taiwan, we have made important progress in tackling NCDs through universal health coverage and strong prevention policies, such as national cancer screening programs and community health initiatives. All these experiences show how policy, care, and education can come together to protect lives and quality of life. I also want to highlight the incredible work of the Taiwan Healthcare Youth Alliance. Taiwan Healthcare Youth Alliance. Oh, it's a very important name. So I have to say it twice, okay? This event reflects not only their commitment to global health, but also their energy and ability to lead with passion and a clear sense of mission. I have worked with them in the past year as a trainer and a mentor, and I'm very proud of them, and I'm very impressed by their creativity and professionalism. Every voice matters, every idea matters. Let us all take this opportunity to engage, contribute, and be part of the commitment for a healthier future. Leave no one behind. Leave no one behind. It's not just a slogan, it's a commitment. Please do not leave Taiwan behind. Please embrace us a family like your sisters and brothers. Thank you.
Thank you so much, Dr. Chu, for the inspiring open speech to the event. Let us begin our keynote speech section by welcoming our first keynote speaker, Dr. Hong-Yi Chu. Dr. Chu is a distinguished epidemiologist specializing in cancer and cardiovascular disease research, also the director of the Institute of Population Health Science at the National Health Research Institute in Taiwan. Please join me in welcoming Dr. Chu. We'll wait for a second for the pointer and the preparation for the speech. Thank you. Thank you for your patience.
Okay, it's my great pleasure to be invited to have a talk in this conference, okay, and especially for hosts from my young generation from Taiwan, yeah. So today I will talk about the dual approach to NCDs through the behavior change of social determinant intervention. As I know, most our young generation from the Taiwan Healthcare Young Initiative, they are most from the medical college. So their point of view is the medical aspect. But I will talk about the other aspect is the social behavior changes. So this is what I mean. I choose the talk to share with all of you. Okay. So this is the content of outline I will talk and share with you and today. And first, I think most of you know the 17 goals of SDG. The participants sit in this conference. So I will not go into detail for the sharing the 17 goals. But however, we know the SDG we most mention about the good health and the well-being. And however, another goals from the SDG, from the goal 4, 5, 6, 10, and 16, the content of this goal, they also highly correlated with the SDG 3, okay? And most from the WHO mentioned the non-communicable disease, they are including the 4 diseases aspect. First is our cardiovascular disease and the cancer, diabetes, and the chronic lung diseases. And these 4 NCD, they account around 74% of the deaths of the world. So this is a very serious health problem in the world, not only in the cancer in Taiwan. Taiwan, the cancer have the top leading cancer for the past 40 decades. But from the global view, the other 3 NCD is also had a very strong health risk threat of the world, okay? Now, I will talk about the NCD and the behavior risk factor. Most of you know there are 5 risk factors for the non-communicable disease. First is an unhealthy diet, and followed by the low physical activity, and also the abuse for the tobacco and also the alcohol. And the other is the recent rising the the very environmental pollutant in the air condition, okay? And we can see around the world, maybe the 7.9 million people, they have the unhealthy diet. And also the 18.7 million, they have the habitually for the tobacco, cigarette tobacco thinking. And the low also nearly the 1 million people, they have the low physical activity, and also the 3 million, they have habitually alcohol drinking, okay? And we can see this figure show, you can see the horizontal axis. They mean from the most disadvantaged township to the most advantaged township, the ranking is from the 0 to the 100. We talk about the deprivation index of area. It means what to propose if the deprivation index, we talk about the proportion of the agricultural labor and also the proportion with the no schooling age between the 18 and the 21st years. And we can see from around the past 10, from 2001 to 2010, for the past decade, you can see the most disadvantaged township, they're sharing very low average life expectancy at birth, and also the disabled-free life expectancy. But this trend, the difference between this index did not change for the past decade. They're around the 8 years difference. So this means the social determined health factor was highly involved with the life expectancy for the past decades, okay? And also, we're using another factor of SDG to share with you. First is the SDG, we are highly correlated with the body weight. We can see if we're using the most depressive and the least depressive, you can see the least depressive, they have a low obesity proportion. But compared with the most depressive, they have a high obesity. And the difference between this proportion of obesity, they are getting bigger in the past decades. And if we using the BMI greater than 24 as the index of the obesity, there are also the same phenomena in the same agenda. Most, you can see male and also the female. And as most in the female, we can see the education level, they are quite different BMI. And the higher education level, they are showing the low percentage of a BMI greater than 24. So it means the SDH were quite, they are quite involved with the body weight, okay? And also we can see from the education level, they are also have the high, the low education level, we have high proportion of the hypertension, hyperlipidemia, and also the hyperglycemia. And this phenomenon also the inverse dose-dependent relationship between the SES and the education level. And also you can see the circulation disease and also the cancer, the phenomena and the situation is also not different, okay? And if you see from the community level, it means not the individual level, from the group level, we can see we're using the DHPR, like a diabetes-related preventable hospital. We can see any DHPC, we talk about DHPC is Diabetes Health Promotion Clinic. If the high density of DHPC, we will have a low DRHP. It means the diabetes-related preventable hospitalization will have lower. And we can see also the ESS is the elder social supporting. If the density is higher in the ESS, we will less than the DRHP. So this is very important. But however, you can see the DHPH, Diabetes Health Promotion Hospital, they cannot show in the very positive impact. It means the reason is the clinical, they can provide a comprehensive and more available for these people. So the primary health care is very important to help people to deal with this NCD proportion, okay? So the other I will share about some program intervention in Taiwan. We can say the dual approach in action. First, we can see how the SDH to interview the health. And we can see the first is the behavior. How to change the behavior. It's very difficult. I teach public health for more than 30 years. Everything I call the drug is more efficiency, but how to change the health behavior, very difficult, okay? So in Taiwan, we provide a social ecological model, and from the individual and the bigger than the community and also in the nation. We call we can call the micro system for the interpersonal, and also the meso system for the community and the institution, and we enlarge to the exo system, to the nation, large in the region. So this kind we very familiar with from the medical point of view. You can see the organ system, tissue level, but the other is the more important for Taiwan in the future to put more effort, put more resources to do this this intervention. So we provide using the sliding scale pricing to provide in Taiwan everywhere from the low SES to the high SES. So the different cost for the different SES people, this means we can provide the same availability and they can afford this program intervention. So under this program, each area, the people, if you join this program, you can see the skeletal muscle mass will be increased so that we will have the same outcome, same health outcome can be applied to the different socio-economic status people in a different way in Taiwan. And also internationally, we're using the high technology device to help them to change the behavior, health behavior. We can use in the wireless watch, wireless ring, and also some device like the heart reverse volume, and also another device. And we also using the AI healthcare manager to provide customized services for our individual. You mean the AI, they will not reject any question. They never retire. So you can see for the older people, in the midnight, they can sleep. So they go up, they can ask the AI to ask any question. So we now using this AI to help them and to provide the personalized intervention, okay? So, but this program, we how to evaluate their effectiveness. So we're using the REM model. REM model, they have different aspects to evaluate the program from the reach. How many people can be regionalists? And also we can evaluate the program the effectiveness and also the adoption. We're using the multi-level, and we check the implementation and also the maintenance. Maintenance is like the sustainability. People we want to let, they cannot quit after the program finish. We hope they can, the whole life, the future life, to practice their health behavior. Okay, so Taiwan can evaluate the database. If you want to evaluate the health outcome, we can use in the National Health Insurance Database. The comprehensive over the 23 million people. So they can have very good health outcome education. And also our government, they carry out a lot of the cohort data to collect the SDH data. And also we have a lot of open government data. We can collect the number of from the financial and also the different data. So using this data linkage, we can evaluate this program effectiveness, okay? So in conclusion, in Taiwan, we using the different social environmental to provide the incentive from the individual to community to nation to help them. And we also the social individual, we're using the several stakeholders to help them. And then the other, we hope the inter-sector cooperation to help them. So in Taiwan, in the near future, though I do a lot of the paper about epidemiology and also the medical device and medical factor, but in the future, I seek how to change the health behavior will be most important and the most effectiveness for our health outcome in the near future in Taiwan and can save the financial challenge from our national health insurance. Okay, thank you. This is my talk. Thank you.
Thank you, Dr. Chu, for a really informative presentation. Now, let's move on to our second keynote speaker, Dr. Padmini Murthy. Dr. Murthy is a globally recognized health professional, physician, and public health advocate. She is a professor and global health director at New York Medical College, the global health lead for the American Medical Women's Association, and the NGO representative to the National United Nations. Please join me in welcoming Dr. Murthy.
Thank you so much. First of all, it's so nice when there's students, because you know what? We were all students once upon a time, but I think we are always learning. So thank you so much for having me. And so I was like focusing on something a little different, because it's like, how is it to have positive partnerships? The reason we are all here is because we're working together. And you know, the SDG pin, the goal 17, is partnership. So nobody can do it alone. It takes a village. So, okay. So I have no conflict of interest, except I have a family. So as you can see, I have the SDGs there, and why it's so important, partnerships, especially now when we're talking about non-communicable diseases. Okay. Maybe it's acting up. Okay. Well, let me go back. So my objectives for my brief presentation is I'm going to discuss the importance of multi-stakeholder partnerships and highlight some best examples. So why are multi-stakeholder partnerships important? Because no one person or one entity can change the world. We need to work together. It's like a three-dimensional puzzle. The only thing is it goes up. So it has to be both lateral and going up. So that's why it's so important. And I can tell you, and unfortunately, more than ever now, with like, you know, I'm sure you've seen the buses as we were coming, like people protesting no pandemic treaty. I saw the blue bus and I took a picture of it. I said, that is okay, expression of freedom. But the problem is, we need to understand sometimes you need to give in for the good of all of us. So. And the other issue is we cannot do this alone. We have some of our guests from the private sector. Guys, we are so thankful to you, because if you guys didn't work with all of us to get the agenda moving, we won't have it. So that's why it has to be a seamless partnership. And as students here, tomorrow some of you may become clinicians, some of you may become academicians, some of you may go into the private sector. And let's not forget AI. The reason I'm bringing up AI is because it's a game changer, but at the same time, we need to make the decisions and control AI. AI cannot control us. So everybody is like the hype of AI. Like, remember when there was the Y2K, they said in 2000, all the computers will shut down and everybody was going crazy. So the reason I bring that up is we need to be very objective, even in our partnership. So you can see on my slide here, and I really like this slide, is you can see how they are neglected. And you can see liver cirrhosis, alcohol substance abuse, other neglected non-communicable diseases. So unfortunately, you know, like for example, I'm going to bring it up. Tuberculosis is an infectious disease, but it's become a chronic disease. When it's not infectious, it becomes a chronic disease. The same thing with COVID. So many of my friends back home in the US who got COVID, now for the past 2 years, they've been having tinnitus. They've been having a brain fog. One of my friends from Germany, who's a radiologist, she goes like, she's had COVID 4 times. And she goes like, Minnie, I'm always in a brain fog. I said, do you remember your name? No, I wasn't joking. I meant it seriously. She said, sometimes I don't remember my name. So that is now, she's not infectious, folks. Ladies, gentlemen, all protocol observed. But she is suffering from the aftermath of an infectious disease. So when we look at the global burden, there's a very heavy burden we have on NCDs, but some of the infectious diseases have become chronic. Even HIV, I'm just, you know, because we can't forget HIV because we have COVID. and some other disease is saying hello and coming in. So RSV, so many things. So that's something we need to be very, very concerned about. And also, so what are some of the advantages? Why are we even talking about partnering? Because we are sharing resources, especially now. We are in the midst of a global crisis everywhere. So we need to pool our resources. And also, when we are, I just basically, just for one sec, want to go over to intellectual property. Yes, intellectual property, but sometimes you need to put that aside, and you really need to see how can you discuss what are you going to do, what is the global good. Because I just can't think of myself, we can't think of ourselves, we have to think beyond. That's one of the things. And you can see that this is something which is so important, the strengthening of the national networks and referral pathways. So one of the things in partnerships is both at the local level, at the national level, and the global level, you really need to have good partnerships. Okay, now, how do you address NCDs? So you can see that this is very important. As a clinician, for 1 minute, I'm putting on my clinician hat, not my public health hat. You need to prioritize and integrate NCDs into the primary healthcare and the universal healthcare agenda. You can't have PHC here, you can't have UHC there, and you can't have NCDs there. It needs to be seamlessly integrated. So that is one thing, those of us who've been around, as you were saying, my respected colleague and friend earlier, yeah, some of us have been around like quarter century or more in this, but the advantage you need to understand is you guys have, all of you young people, you have so many more resources than we had. So, but sometimes we talk, it's not that we are dinosaurs, you need to listen to us, because we can tell you how you integrate clinical work and public health, because it has to be seamless. And also, as you can see, people-centered, this is so important. It needs to be people-centric. That is something, that's why you have personalized medicine now, but you need to have, when you have a public health approach, it needs to be people-centric. And everybody is a stakeholder. So that is something you need to understand. And also leverage the advantages of new technology. You have, AI, you have, you have a lot of digital technology, so many things, but we need to leverage it. Because I always tell my friends who are programmers, I go like, yeah, you're building the algorithm, but you need to talk to us to ask you what questions or what you're going to build into the algorithm. I don't know how to build an algorithm, and I don't want to know. But I can tell somebody who's building it as what you need to focus on. So that's why it has to be patient-centric, people-centric, because prevention is also important, very, very important. And why do you think I'm talking so much about primary health care? Because if we have a strong primary health care system, that's half your battle won. Because a stitch in time saves 9 before it becomes worse. Like, when the professor was talking about all the cancer things, it's like early detection goes a long way. Okay. Now, look at the role and power of partnerships. You have increased workforce participation, you have a boost in your GDP, you're sharing resources, you have a reduced healthcare expenditure, people become healthier. And one thing I want to stress is look at the social determinants. Look at the socio-cultural. Earlier this morning, I was at an event where they were talking about congenital diseases. Some of them, congenital malformations, are chronic. And there were 3 of these young people who were survivors. One of them with a club foot. And she said she spent so much of her time getting treated, and then she could finally walk. It's the same thing with a cleft palate. So what I'm saying is it's just not these. The paradigm of chronic diseases expands so much more than hypertension, diabetes, and mental health, folks. It's such a major challenge. So this is something which is very important. Okay, so what do? Enhanced resource mobilization. In a room like this, we all share opinions, so we know what's going on, right? And then improved access to care, especially in low and mid-income countries. Taiwan, you guys are doing such a great job in supporting so many other countries. It's the same thing. Why do so many of us do aid work? Why do we go there? Because you want to try to level the playing field. We can't do it, but we try to do our best. And also evidence-based. You were talking about research. It's so important because whatever you do, it needs to be evidence-based. And also studying the social determinants and all the inequities. Because you need to see, even in a particular country, like I'm from the US, so in some parts of New York, there are some diseases, chronic conditions, like asthma. In the Bronx, I don't know how many of you have gone to New York, we have the Greater Concourse and the Bronx, very high incidence of childhood asthma. Why? Because a lot of them don't have access to primary health care. The first time they see a physician is when they go through the triage to the ER. But it's just, this is the problem. You just fix their issue then, but after that, there needs to be a follow-up. So we really need to understand why this is happening. Okay. Then what are the key elements, what we are focusing on? Visionary leadership. This is so important. Whether you're a student, whether you're an academician, you're a practicing clinician, you're in a healthcare administrator, policy, pharmaceuticals, this is so important. Shared values and goals, that is important. And also dedicated human resources. How does that happen? By training. You pass the torch. So as my friend here, Betty, was saying, it's so important. That's the mentoring we do here. That's why it's so important to have forums like these. Okay, and you can see this. The reason I put this here is you can see the relationship between primary health care and non-communicable diseases. One of the main things I want to stress is lifestyle and behavioral modification, wherever you are. So it's not that you're going somewhere and eating so much of fast food and saying, oh yeah, I'm going to exercise tomorrow. That's not going to help you. Okay, and also adequate supply of medicines. Because so many times when in this global challenge, financial crisis, people don't know whether they buy food or medicines, which is so sad. It's happening more and more in the US. If you're on a Social Security check, do I put food on the table or do I buy my medicines? So, okay. So social determinants of health, very briefly, as you can see, these are the modifiable or unhealthy diet, physical inactivity. Walk out there. It's a beautiful day. Just go for a walk after this. So, and then what are the non-modifiable risk factors? Age, gender, genetic factors, ethnicity. But now even with AI, hopefully we can modify some of the genetic factors. But globalization, urbanization, migration. These are different categories. Don't think urbanization and migration is the same. They're all different. Yeah, thank you. I'm being reminded of the time. And what are the risk factors you can see? So I would also add mental illness too. And as I said, the infectious diseases which become chronic. Moving on, again, one example of best practice is what they did in Vietnam, where they talked about educational training. This is a very nice slide, and you know what? You can share my slides with whoever wants. And this was really a very good thing they did. Interest of time. Last thing, I want to focus on gender-based violence. In my opinion, that's a chronic disease because it's a global pandemic. And it, a lot of mental health. And it's $1.5 trillion. You can see all this, the impact of COVID increased. And that's why the reason I have this here, because you can link it to mental health. Power of partnerships, he for she, resist violence. You can see how everybody works with the UN. Long COVID, as I'm finishing, is this the white elephant in the room? I just mentioned it. Again, I'm concluding with that. Unfortunately, this is something NCDs will inflict $1.3 trillion in losses. We need to act now. Okay, recommendations, what do? I like this, PREMEA, prevention, response, early intervention, multi-sectoral approach, empowerment. We have to empower all of us. It's just not women's empowerment, addressing gender inequality, because women are at the bottom of the rung. I'm not saying it because I'm a woman and I have a daughter. In conclusion, strong partnerships leave no one behind. So thank you so much for the opportunity. And this is my favorite quote by Margaret Mead: "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever does." Margaret Mead. And I see that among all of you young people sitting here. Thank you. Thank you.
Thank you, Dr. Murthy, for your insightful presentation. Now, let's welcome the third keynote speaker for today's section, Dr. Chao Kai Zhang. Dr. Zhang is the CEO of Taiwan Nobel Medical Group and the General Director of Taiwan Nobel Eye Institute and the President of the Taiwan Ophthalmology and Optometry Medical Society. Let's give a big hand to Dr. Zhang.
Okay, ladies and gentlemen, it's my honor to have a talk here. And I was invited to be here about 2 weeks ago. So as an ophthalmologist, I would like to talk about the vision healthcare in Taiwan. Okay, so the agenda will be historical background of my company, and then the public health challenge in vision care in Taiwan. And so we should talk about how to management and the prevention about all of these eye disease in Taiwan currently. So we have a cataract, we have the myopia control, we have a laser vision correction, we have a glaucoma prevention, and also we have a retina disease and the dry eye disease, DED. That's very common. It is 3C. You know, this year, I think the 3D impact of the vision damage is very serious. So history background. Okay, we have 30 branches about the eye clinic in Taiwan. This is the headquarters in the center of the Taipei city. And we have about 24 years history already. And me and my wife are all eye doctors. And I have also PhD in law school. And my wife has also a certification as a skin doctor, dermatologist. So this is all the 30 clinics in Taiwan, around Taiwan. And we have over 60 eye doctors in Taiwan. And because my wife is a dermatologist, so we also have 4 to 6 clinics for the skin care. And we have some about 15 skin doctors in our group. Okay, so this is all the service we have. So we have the eye clinic, we have a skin clinic, and also we have an anti-aging clinic. And we also have some beauty clinic. And in order to guarantee the quality of health care, so we have a lot of the certification from Taiwan and also international, JCI. Okay, tracing back to the history, why I joined about this NGO is because when I'm a medical student, I attend the 7th Asia Medical Student Conference in 1986. So it's very long ago. And we also host the international conference in 1988. This is when I'm third grade, and this is my 5th grade when I'm a medical student. And after the graduation, I always attend the AMSA meeting in Taiwan. So that's why I'm very familiar with all the students, and that's good for our NGO. And after graduation, I attend the AMDA, Association of Medical in Asia. So I graduated in 1990, so I attended AMDA in 1991. In the future, I would like to, to take all the AMSA students in Taiwan to AMDA. And the mission of the AMDA is the international emergency relief. It's not only the conference. And this anniversary is 40th anniversary international conference of AMDA was hosted by AMDA Indonesia last year in Bali. So we do the emergency relief. As an eye doctor, I do a lot of charity cataract surgery in very rural area of Asia Pacific country. Related to the healthcare challenges, vision care in Taiwan, so we can talk about some topic. And as a professor, now I have let me see. I think I have about 78 articles, published now. So in terms of the statistics for the global, so we can see from this slide, the cataracts have 94 million affected population around among global. And uncorrected refractive errors are 88.4 million. That's meaning the refraction error, that means the myopia, astigmatism, and hyperopia. Regarding to the presbyopia, everybody will getting old. Everybody has presbyopia. So that is the current global situation. How about Taiwan? So there are 73% of the myopia population during the 18 to 24 years old. That's very, very serious, And astigmatism also at 42%. After 40 years old, 50% of Taiwanese, they have presbyopic problem. And after 65 years old, 30% of the population of Taiwan has the cataract disease. So we can see the peak, okay? So the myopia, the peak of the myopic will be 20 years old. And the presbyopia will begin as the 40 years old. And the cataract problem will happen since you are 60 years old in Taiwan. So how about glaucoma? In Taiwan, glaucoma surgery is typically reserved for the severe case because normally we do the medication and we also do the laser surgery. So we can see in 2023, 3,000 surgeries were performed only. Most of the glaucoma treatment was by medication. So globally, glaucoma affects about 80 million people. So that's a serious problem. So let's talk about, we talk about the cataract, we talk about the myopia, then we talk about the myopia. So myopia is rising rapidly worldwide. So in Taiwan and China, up to 90% of teenagers and young adults are nearsighted. That is a big problem. And the most serious is in Korea. Korea in Seoul. So you can see a study showed 96.5% 90 years old are men. I think women the same, are myopic. And in the United States, the rate are below 50% only. So that will be the public health problem in Taiwan. And why is that? Because there are limited access to the eye care service and the 3C product and the behavior changes and aging problem and the comorbidity burden and also the financial burden and insurance limitation for the myopic control in Taiwan. So how do we manage and to prevent this currently public health problem in Taiwan? So in cataract, so we can see it's not only for Taiwanese, I think it's for all the global citizens. We should protect your eyes from the UV light, and we avoid the smoking and access the alcohol. And we should eat a nutrition-rich antioxidant diet. And we have to manage your chronic disease, such as the diabetes and hypertension for sure. And we should limit the long-term use of the steroid. And we get a regular eye examination for sure. So I think we have to have our eye checked every half a year, at least. So how about the control of the children myopia? So the lifestyle is very important. This is THYA 120 program, meaning that you have at least 2 hours outdoor activity every day. Do you think it's possible? But it's very important. And we should follow the 20-20-20 rule. So every 20 minutes of new walk, you should look 20 feet away for 20 seconds. It's possible. But you have to take a rest every 20 minutes. Do you think possible? But I think it's work, because we have studied it's work. As long as you can do this, and the myopia will not progress. Okay, and this is lifestyle control. Next one. Okay, the medical. We use the atropine currently. Atropine is very, very effective. However, a lot of complication. You have photophobia. You cannot see the near. You cannot see the near for at least 8 hours to 16 hours. But currently in Taiwan, children are under the medication of atropine. However, the concentration is 0.01%. The 1% is most effective, but it will last for your psychoplastic problem for 24 hours. That means you will always have your psychoplastic pupil. So how about the surgical? Okay, optical. So you can have the glasses, you can have the soft contact lens for sure. But currently, the OSO-K is very effective in Taiwan. And on my side, that's meaning your control contact lens now is the mainstream. So you still have the glasses or the soft contact lens, but you still can control your myopia progress. That's a good idea. So you don't have to use the atropine anyway. So also we can use the multifocal glasses for children, but the children have to use to that, just like the Asian population use the multifocal glasses for the presbyopic, but it's the trend. So this is optical. So how about when they get adult, that we can do the laser vision correction. So we have the TPRK LASIK, and we have a CADX. And now the CADX procedure is the main trend for the correction of your vision problem. It takes about only 2 minutes. Then you can take away your glasses anyway. But there are still some problems talking about the CADX, the PRK, the LASIK, the vision correction. But you have to select. As a doctor, we have to select the proper procedure for the proper patient. That's our goal. Okay, glaucoma, very important, because normally the people will try to go to the eye clinic to check their intraocular pressure. But actually, the glaucoma the prevalence is high. So you should go to the eye clinic to check your pressure, not your pressure, systemic pressure, but your eye pressure, about every 6 months, okay? But anyway, if you have the glaucoma problem, you can take the medication therapy. You can take the laser and the surgical treatment. However, the medication therapy is very effective in the early stage. Then you will prevent the blindness for 30 to 40 years. So it's very important to do the prevention of glaucoma. Okay, so you see, get a regular eye examination every 5 to 5 years if under 40. And know your family history. It's very important because it's hereditary. And protect your eye not to be damaged or trauma. And use prescribed eye drop, not to use the steroid. Okay, retinal disease is also important. Retina detach is very trouble cases for the patients because after the surgery, you have to lie on the bed for 1 month. Wow, that's very suffering. So retina is a serious eye emergency. And where, you see that? Where the retina separate from the blood vessel and supply oxygen and the nutrient. So the key risk factor include the age of 40 to 70. High myopia. High myopia is a problem. High myopia will cause the cataract, will cause the glaucoma, and will cause the retina detachment. So we should go to the eye clinic to dilate your pupil, to check your fundus if there are some break, if there are some floater, if you have some flash. That's very important. That is the early oral about your retina detachment. Okay, so what we do, we can do the laser therapy, and we can do the pneumopexy, and we can do the surgery of a scleral buckle, and also can do the vitrectomy. But once you have a retina detachment, even you have very good surgery, your vision acuity will also down to 0.6. Okay, last but not least, I would talk the diabetes retinopathy. That's very important for the DM patient. So now we are screening the the people age over 60. As long as they have the diabetes, should come back to the clinic for follow-up every 3 months. And the best way to protect your vision is to manage your diabetes. For sure, you have to control. Okay, I have 1 minute only, so I would like to talk about the last issue. That is the dry eye disease. Everybody has the dry eye, actually, because you have lots of burden on the 3C product. But you have to understand, there are 3 layers about your tear. Okay, so the internal tear, you have the mucin layer in order to attach the epithelium of the cornea. And the major aqueous layer occupy about 90%. And the last outer layer is the lipid layer in order to prevent the aqueous layer to evaporate. So you have to use the right artificial tear. So this is mucin deficiency, eye drop. You have to do this one. This is the problem. Vitamin deficiency, chronic conjunctivitis, chemical burn, radiation therapy will cause a mucin deficient dry eye. So next slide is the aqueous deficiency, and age-related, and the poor nutrition, and exposure to the ocular radiation, and damage to the lacrimal gland, and autoimmune disease will cause the aqueous deficient dry eye. And last but not least is the lipid deficient dry eye, and that is membrane dysfunction. We call it the MGD. So the DED, dry eye disease, have 3 kind of risk factors. So you have to diagnose which layer you have problem, and then use the right treatment in order to improve. So the last one will be conclusion. So Taiwan continues to face range changes from aging population, so that will increase myopia prevalence and the chronic ocular disease. So the integrated approach to prevention, early detection, and innovative treatment is more important ever. Okay, that's all my as a ophthalmology topic. Thank you very much.
Thank you.
This, the last one. Last one. Hello. Last one. Yeah. Okay. This is my wife, and they are my 2 daughters. And this daughter is now the pediatric. Is take care of the kids. And this daughter is a lawyer. So we need a lawyer to protect our 3 doctors. Thank you.
Thank you so much, Dr. Chung, for the inspiring speech. And that is the end of our keynote speech today. And us moving to the next session is the panel discussion in this session. I'm going to invite all of the speakers and the 2 panelists to come onto the stage. And let me take a few seconds to introduce our two panelists joining us today. The first one is Dr. Pablo Estrella Porter, the chair of Junior Doctors Network. And then is Ms. Hoi Shen Focolata from International Council of Nurses. So firstly, I would like to pose a question about the challenges of sustaining the multi-stakeholder partnerships in global health efforts to Dr. Murthy. While partnerships are crucial in addressing NCDs, collaboration across different sections sometimes face some barriers or difficulties. And I would like to know, in your experiences, what are the biggest challenges in sustaining multi-stakeholder partnerships, and how can we deal with it?
Thank you so much. So I'll try to answer your question in 2 minutes. Some of the biggest challenges I have found is people have egos. They don't want to put it aside, and they think they know everything. Like I always tell my medical students, don't think just because you're from the US, you know everything. You need to talk to them. See, the main thing is you cannot impose what you think is right for them. Lack of proper needs assessment, lack of working with the local partners, and communication. And you know what? You need to reach a common ground. Look, no two people agree. I mean, I'm sure, all of you will be fighting with your moms. My daughter's half the time fighting with me, that's a different story. But what I'm trying to say, we need to find a common ground. And also, for any successful multi-stakeholder partnerships, have a timeline. Have a timeline which is reasonable. And just because somebody is young, you don't say your input doesn't matter. So it needs to be across generations, across disciplines, and also you need to speak the same language and have a spokesperson from the community where you want to address the NCDs. The last thing I want to tell you is a few years ago, we did a project with the Bangladesh immigrant community from NYU. And one of the main things was we spoke to the women, the social cultural, because the men were giving answers. So we said, no, we need to talk to the women to tell us what their challenges are. And they said a lot of times they couldn't go for the checkup because the men had to come to take them. And a lot of times the clinics would be closed because most of the men were working in construction. So then we said, look, we are giving the subway cards. There's somebody from your community, a retired teacher, because there's a lot of respect for teachers. So who will go with your wife? See? So that's what you do. So very simple and KIS, keep it simple. Thank you.
Thank you so much for your sharing. And next, I would like to bring the discussion to social determinants of health, including factors such as education and income, to Dr. Hong-Yi Chu. Social determinants are really difficult to change due to the complexity, and why should we still incorporate them into health promotion? Thank you.
Okay, thank you. It's very tough question to be answered. Yeah, as I mentioned, the social determinant health related factor like health behavior is very difficult to change, and also they involve some socioeconomic determinant factor like the salary, like the education. So how to change the mindset is very difficult. In Taiwan, also in the country of the world. So in Taiwan, we're using some high technology device. And recently, the NHI, we want to provide some AI assist the health promotion solution for our patient. We're using the big data analysis, big data information from the Taiwan Healthy Bank. This bank data was received the agree to provide from our patient. And we link this data and using some AI data analysis to do some kind of the NCD disease risk prediction. For example, if your blood pressure higher than some number, maybe over the 160, over the 118, or you have the diabetes history maybe more than 10 years, and you did not have the poor control of hyperglycemia level, then we using some model, we can give the information, predict maybe in the in the coming 10 years, you might be affected with the cardiovascular disease or any stroke, maybe in the 10 to 2015, for example. And we're using the red signal to our patient. They think, oh, wow, gosh, I needed to do something for my health. Otherwise, if the medical doctor, they do a lot of work in the health promotion education, but the disease, the patient, they did not see any real data for them. So the effectiveness is quite low. So using this kind of the data analysis and using the vision for some risk information, I think there will be some impact for our patient. And it's very important because in Taiwan, we are facing some challenge of the very low birth rate in Taiwan, and our life expectancy is getting longer and longer. So we're facing the very extra older society. So in Taiwan, the people greater than 65 years old, they cost 3 times medical resources compared with the people less than 65 people. So if you challenge, because the big pharma, the new drug development, they will not come to Taiwan first. Because once Taiwan have a deal with the price, the other country maybe, oh, Taiwan can. We also can get a drug using this same price. So in Taiwan, the challenge might be we cannot very difficult in the first time to have the good, have the new drug, especially for the cancer or something like NCD. Yeah, we might be the second or third hand for the drug. Other country can have the maybe prices.
I advise as an older person to, not like an ancient person, but definitely older to you. So that would be my advice. And you got to get enough sleep, because that's one of the things. And my physician called, because we all are insomniacs. Like we function with 4 hours of sleep. That's not good. So you know what I do when I'm on a plane now? I don't turn on the Wi-Fi, I sleep. So you got to catch up on your sleep, and you need to do that, and then spend that 20 or 30 minutes exercise, whatever you do, whether you walk, gym, yoga, anything. Because if you're not healthy, how can you tell somebody else, like, do this, and they look at you and go, you don't look healthy, so why should I listen to you, right? So, thank you.
Okay, I think that 30 minutes exercise and 8 hours for sleep is good for your eye health. Thank you.
Probably, I can also add from the experience from youth organizations. Lately, we've seen that there's much more interest on NCDs. It's true that also having this year the high-level meeting on NCDs, it's a key moment. I can tell you, for example, from the Junior Doctors Network, we're about to open as a working group for our members from junior doctors from around the world, because we see that there's a lot of interest. So it's also our role when we have this kind of structures as young organizations, especially if they're health related, but even if they're not health related, also to look for this kind of opportunities. Just to bring a couple, for the preparations for the UN high-level meeting, there was also a pre-conference of the second general meeting of the WHO Global Coordination Mechanisms on NCD Prevention and Control, where there was also a call for youth representatives to attend. Luckily, we were able also to be there online, as well as there happened just a few weeks ago, the Youth Multi-Stakeholder Hearing. So actually, if we see in the international level, youth voices are needed, and actually we're given the floor. Now it's a role, I would say, in a local and national level to bring the attention to especially our youth colleagues to get interest on this topic, because as you were saying, NCDs might be a long-run problem, but probably we need to shift the messaging. We've been seeing in public health, for example, how effective we've been for controlling tobacco. But now tobacco industry is coming back with, for example, e-cigarettes or vapes. So we probably need to change the message instead of just blaming the population and individuals, and especially the youth, but actually questioning them. Who is benefiting from them smoking? Who's benefiting from them drinking, right? So probably we need to change the narrative. It's true that young people are really good, especially using social media, gathering together, making movements. So I would say that probably look for this kind of support structure. I can say, at least from my side, from the Junior Doctors Network, we're really happy to support, but there's also other youth organizations such as the WHO Youth Council, which associates different organizations, not necessarily just health related, that are also promoting this kind of initiatives. Thank you.
Okay, I will make some my suggestion is for NCD. This is the all age the health promotion program. For the children and the youth, you might be control your body weight. You might be control. You might be have a habit for the exercise, the good nutrition food, and maybe in the elder people. There are some you have affected with hypertension or some the hyperlipidemia. So you need to control. You control your blood pressure, control your hyperlipidemia, everything. And so the different age, for the young age, they are want to delay the instance of NCD, or but for the elder, they are delay the progression for the NCD to be affected with more severe disease like a cardiovascular disease, like a stroke, like any kidney disease. So the most important is the health literacy. And this is the health literacy. To establish the good health literacy, they need the multi-sector to cooperate each other. Like for the young, we need to do education. And now we have more and more solution and good, like the Dr. Zhang say. There are so many, the strategy is the proof, very good evidence. But how to persuade the good information to the different ages is very important. But however, mostly in Taiwan, we are too focused on our children to get into the good university, get into the good junior high school. I think our education primacy needs to some more differences. How to have our children have the good life, a good insight for their future career. This is very important. But this takes time and need more sector, more stakeholders to cover each other. Yeah, this is my comment. But we still have a long way to go. Okay.
So, Madam Chair, I just wanted to add one point when you're if I may. When you spoke about health literacy, one of the things you all need to understand when you're communicating, it needs to be at a level. You may have a PhD coming to you, you may have an EDD or an engineer or a rocket scientist, but you need to use the language they understand. So one of the things we have is we tell our medical students, talk to somebody at a second grade level. No, to get the message. It's not an insult on somebody's educational, but for example, I just said, like, somebody in AI, okay, I know a bit of AI, but I would say I'm a toddler in that. But if somebody starts talking about all the languages, I go like, can you dumb it down so I understand what you're saying? So the main thing is the communication. It needs to be clear, concise communication. So 3 C's. Thank you. Thank you.
Yeah, last but not least, I think for me, I think the panel has already touched on some really good points about health literacy. I think that's a very important concept, like how do people understand their health, and as health professional like nurses, doctors, how we can advance health with them. It's about partnership. It's about people-centered care, as Dr. Murphy mentioned. Maybe one thing I want to add is about NCD itself. It shouldn't be a distant concept to young people, because when we look at NCD, actually mental health is also NCDs, and we now see the high prevalence of mental health among the young population. Actually, it's very worrying. And because of that, I echo what Pablo just mentioned. You mentioned about actually health. Young people are very needed, for the advocacy now, and we need to include them. And apart from all at the global level, the event that you mentioned, I think that's something they also can connect to this health agenda, is about connecting to the association at the national level. Because if I'm a nursing student, if you are doctors or like medical students, like you would like to connect to medical associations, like in Taiwan or in your country, I think students can always start with that level, like connect to the nursing association. I think they will be very welcome, and to connect with the students that they're interested and they are keen to progress in this health agenda. So I think that's one thing I want to add. If you want to look into a more global picture, of course, you can also this occasion, like World Health Assembly, you can go online and find all the information you need. But at the national level, I think you can always start first with the community level, and also at the national level, connect to your association that can help you to navigate with this kind of health topic.
About so what is the the uniqueness or difficulties in terms of health inequalities that Taiwan is facing now? Yeah, thank you.
Okay, I think health, even Taiwan is a small country, we're still facing some health inequality. So we're using some high technology, like the Professor Dr. Zhang said, in our rural area. We are very shortage, cannot have a more special medical doctor, our doctor in the medical center. They can do the good diagnosis and pass the information to GP, and then they can provide a good treatment for this the patient. So this is some kind of technology in Taiwan. We need to help or to provide our residents in this area. They can see the good quality of the medical treatment. Okay, so this we can reduce the health inequality in Taiwan. Yeah, and this kind of network is quite efficient and effectiveness. So maybe Dr. Tang can use the eyes as the example. Yeah, okay.
Thank you very much.
Okay, except the rural area deficiency care, I think the national healthcare system is another problem because of the budget. So in my perspective, I think the Taiwan national healthcare system should cooperate with the private sector, cooperate with the private sector in order to, to do some other deficit compensation then all of the citizens might be insured, and that's good for all the general public.
Yeah, I agree. But the private sector might be very severe because somebody will argue the rich people, they can buy the good insurance support from the private sector. So the very detail how to design this protocol, we needed to think. I personally, I agree, but how to detail, to check balance we must be prevent the rich people, they can give more supporting from the private sector. Yeah, and then we need to think about this, okay.
Thank you so much for responding. Are there any comments?
Hello, hi, I'm Catherine, one of the junior doctors working in UK. I'm also a Taiwanese. So working in both systems, I was just wondering, Dr. Murphy mentioned about the importance of primary care in terms of for the non-communicable disease. So as a doctor working in different countries, I'm just wondering how junior doctors in our level will be able to help promoting this information to the community, or how would it be able to collaborate between different countries to help prevent this non-communicable disease in terms of internationally in our level as a junior doctor. Thank you. And this is a question open to all the speakers. Thank you.
So thank you for your question. First of all, nobody's a junior or nobody's a senior. Like, everybody is in that. It is just the experience. So in answer to your question, it's important, like, we send our students to medical brigades. We have that. So where they go with a faculty, a clinician, and they're mentored, and they meet other students. So that is a way of interacting. And like this, you have your junior doctors network, and you know what, you guys feel free, like there's so many seasoned professionals, and you got to ask people. It's not harassing them. Please, can we follow you? Can we shadow you? What do you do? Because it's basically, one day you'll be sitting here and passing the torch. So in order for us to do that, so you have to, and you have social media. I don't like X anymore. I'm on Blue Sky and LinkedIn, but I'm just saying that use social media to communicate. So like, network. Like, you see somebody, you go and say, okay, so what are you doing? So try to, especially at forums like this, or the APHA, the World Health Forum, and also the other one which happens in Germany, I'm blanking out on the name now, so many, like COP. Anywhere you can go. Because one of the things is, as a student, they reduced rates, and a lot of these UN conferences are free. So you should go. And even if you can't go there physically, like during COVID, we all followed everything online. So it's a way of learning. And LinkedIn is a great way, because you can see so many groups there. Again, LinkedIn is not paying me to talk about it. I don't have shares in LinkedIn, so full disclosure. But what I'm trying to say is you need to connect with people. Because so many times I keep getting messages, oh yeah, we heard, okay, yeah, fine, this is what you do. So try to, and if they don't get back the first time, it's not that they're ignoring you. So wait for a week. If they don't get back, send a gentle nudge, like say, they will get back.
Thank you.
If I can also add, well, I'm finishing my residency in public health and preventive medicine in Spain. So it's true that many times, even as medical students or as junior doctors, when we go to our specialization, sometimes we forget about all what is around the patient. And for example, primary healthcare is the basis for also our health systems. And all the community work that we can do with them is essential. Because it's true that once the patient is already in the hospital or is already in the consult, it's already late for the prevention. And there's a lot of ways to engage. For example, WHO has many world days, for example, Anti-Tobacco Day or for the alcohol prevention. And I think there's a duty from us to also try to engage on these healthy lifestyles, but also work with interprofessionally, because many doctors were really used to these dynamics, just working with our profession, but working interprofessionally, and not just in health, in the health sector, but also with the other areas that affect also the health decisions from patients. We were discussing before about social determinants of health, and just to bring a quick example from where I'm doing my residency in Valencia, they started also this kind of community-based kind of groups, where basically in each health sector, they would have the primary healthcare center, but as well as the pharmacy, the school in there, the representative from the major. So they're bringing community together for doing health promotion. And I think as physicians and any healthcare worker, we should promote to this interprofessional work in the primary prevention, especially when it's where we can do most effectively our work.
Thank you so much for highlighting the networking and also the importance of the community engagement and the contributions. Are there any questions on the floor?
Hello. Right. First of all, thank you all for the amazing speeches. I learned a lot from them. And then my question wanted to refer all the speakers here, as we have joined some of the side events these days. And then I think for every speaker, you mentioned about data. So I wanted to stress that I think for NCD prevention, data integration is pretty important. And as we have all kinds of participants from different backgrounds today, and I know that, well, as a Taiwanese, I do know that we have a rather comprehensive healthcare systems, but I don't know about other countries. So I wanted to, what my question really is about, I wanted to know about like different perspectives when it comes to the data integration of health systems, and especially when we're talking about tackling NCD preventions these days. Thank you.
I can jump in first, and other panelists can add. So I think, in my opinion, like data is really important on various reasons. I think on for analysis, and also like for implementing strategies, like for advocacy, and so I think regarding that, I think it's really important to have the support from the healthcare workforce, like because when you collect data, you need nurses, doctors, you need health professionals working in interdisciplinary team to collect those information. And so we need to educate the healthcare workforce about this, and they need to know how to do it, and they need to know how to, properly, and also, for data management, and also we need to educate them. So I think that's one point. I think the second point is that how we can make the data accessible, like throughout the health system, is also very important. As you mentioned, in some countries, they might have more sophisticated system for data management, and how to make use of the data for advancing or preventing non-communicable diseases. But I think there's still a big gap between countries, like in high income to low income settings. So I think that's something we all need to work on. Those are the 2 points I would like to raise.
I want to add on the prevention is the best policy for healthcare, prevention. And the data management is the key for the prevention. That's it.
I would just like to add that data sharing is very important. You can't keep it in a safe or something. And the other thing, more and more AI is being used, need to make sure the bias is addressed, because that skews the whole thing. So you need to look at the bias and data sharing. Thank you. Now we'll give it to the expert on data. My friend here.
I think the data sharing is the gold standard, but you need to know the data sharing. They have 2 problems. One is the security problem, and the other the data format, how to integrate each other. So we need to have the standardized format from the global viewer point, and then we can share. And like the UK Biobank, they are very smart. They provide their data to all the academician or big pharma to do the research, and then they input the data. So this is a good model for the UK Biobank. But in Taiwan, we also facing some conservative attitude for the data sharing. Too much talk about the national health security. in my opinion, now we have a more smart technology to deal with the security problem. But the other is the mindset. Our government is so too conservative. So we need another the way to go. But you were mentioning it's very good. Data sharing is more important. And the rich countries can share the data for the poor country and use our expertise to share them. And we hope that no one behind. Yeah, each evidence, each treatment we can share for the global. We are only the one plan. So we needed to share. Okay, thank you.
And if I can quickly add, technology is going really quick, but it's true that the implementation in health sometimes is slower because of all the implications and ethical implications that it has. But for example, just seeing around the room, I see that some people has also a smartwatch. That's already collecting a lot of information. And it's also key that we do on the health literacy, the same people and patients be aware that this information is also key for their following up and also for their health promotion. So there's certain issues, even inside countries or even inside regions for that data sharing. I've lived that myself working in the hospital. Even in the same region, hospitals don't communicate. Imagine between regions or countries. But still, I think we have to give this concept to patients that also the data that we have in hospitals, in health centers, is actually owned by the patient. We are accessing that information, and of course, this is a long conversation because all the data security is also involved. But as long as we also go together with the health literacy part, especially technology-wise, we should be able to break down all this information that different technology is collecting for actually improving the health of our patients. For example, how well are we sleeping? As we were mentioning, how important is sleep? If you use any sleeping track application, might also be able, for example, to identify which is the best time for you to go to sleep. It's true, what you don't measure, you don't know. So if probably you're not really super aware how many hours you're sleeping, once you start using and start receiving notifications, how many hours, it's like, probably I should stop scrolling on TikTok and go already to sleep. Thank you.
Thank you so much for the opinions, especially pointing out the essential parts of the supporting system, education, and the data sharing and data management. Thank you. And I think we can open the one last question on the floor. Does anyone like to?
Thank you. Well, thank you all so much for the informative speeches. I'm Ima, also part of the Healthcare Youth Alliance in Taiwan. And my question is actually going to be a little bit off maybe from what we've been talking about. I'm graduated from Global Health Masters. However, right now I am kind of like in the entrepreneurship era or like environment around me. And I'm trying to connect back to my majors in health and everything, and I am thinking that talking about the diverse people, audience right now in this room, and I was just thinking, I had this early thought about just like mingle as much as possible so everybody are on the same page and trying to promote for the same, advocate for better health. I was thinking if you all, like any of you, have some thoughts about incorporating some maybe innovative ideas from like private sector, but not the big companies, like the smaller ones. Have you guys ever had any experience on maybe cooperating with some early on stage startups or innovative tools for NCDs or for whatsoever? Yeah, I'm just very curious. Thank you.
So at the moment, actually, I'm advising two startup companies, and one of them is by this young person. So during COVID, he developed an app with UNICEF, got the grant from UNICEF. So it was to identify the breakdown in the vaccine delivery. It really was useful, and it was rolled out in a few low and mid-income countries. So now one of the things we are looking at is antimicrobial resistance, which is a major issue. So how can this be addressed? And so what is being designed, without going into details because I can't break confidentiality, is just to say that, okay, so this can be used, this particular tool can be used by the patient, by the patient advocates and even physicians. Because one of the things, like when, as you know, when you're prescribing any medication, and you too, like you have to see the cross reference. We always used to pull out our books to look at that. So, but this is a whole way of how does it. And one of the things, this app can answer your question in 80 languages. So if you type it in Mandarin or Cantonese, it will get to something else. So I'm just letting you know. So, this is the way, and these startups will definitely, so many revolutionize, and there were so many, there's so many, but then again, remember, unless there's persistence, 6 months later that may go. So you really need to be very persistent when you're working in a startup and believe that your conviction is going to, and that's one of the key things. Thank you.
Thank you so much.
Thank you so much. Thank you so much to pointing out the key. And on behalf of the Taiwan Healthcare Youth Alliance, I would like to sincerely thank you, the distinguished speakers and panelists, for your invaluable contributions to this session. Thank you so much.
Thank you. And a great moderator. Thank you. You did a great job.
Thank you. And now we would like to invite you to go back to your seats.
Okay.
Yes, sure. Sit it or stand?
Okay. So do you want to just do that thumbs up? As you guys do in Taiwan all the time. Thank you. Thank you very much. Thank you. Yeah. Oh, yeah.
And still, please stay for a while. We are going to present the certificate of appreciation and also to take the group photos. So please do not leave so fast.
So hi everyone. I just want to mention that we still need to take a group photo right here. So just please give us another 30 seconds. We do have more time for you guys to do the networking later. And now we will be representing our certificate of appreciations first. So.
Please gather to the middle of the menu and please listen to the instructions from our photographer. We're going to take a group photo. Thank you so much. Please kindly stay at your seats. And we are going to take a group photo together. We are going to take a group photos now, and please listen to the instructions from our photographer. Could you please arrange into the middle of the venue?
3, 2, 1. One more. 3, 2, cheers. Everyone, some. Okay. NCDs. Okay.
Thank you so much for your cooperation. And I will also invite the speakers and the panelists to stay for a while. Thank you so much for your participation. And now we are going to have a 10 minutes break. And we'll come back for the youth engagement workshop later on. Thank you.
青年团的大家到前面来跟张院长拍照。对，好。青年团有空的大家到前面跟张院长拍照。
抱一个吧，我们的。 每年有一场会议决定世界的健康未来，你听过吗？这是一个叫做世界卫生大会 （World Health Assembly） 的会议，每年5月会有194个国家聚集于日内瓦，决定未来1年全世界的健康治理方针。会议中讨论的内容包含我们生活中看得见的各项医疗卫生议题，像是疫情应对、传染病防治、心理健康、气候及经济影响、医疗资源分配等等。或许你会觉得这么大的会议离我们太遥远，台湾又被排除在外，和我们有什么关系？但你知道吗？青年也能透过平时的科普推广，发表政策建议，甚至到现场参加周边会议为自己发声。健康医疗从来就不只是专家的事，我们不只是未来的医疗工作者，我们同时也是倡议者、发声者。世界卫生的讨论不应该只有少数人参与，每一个人的声音都值得被听见。
Distinguished guests, we'll start our second half of the forum very soon. Please come back to your seat. Welcome back. Please take a seat. Okay. Okay, please take a seat. We're going to start right now. Okay. Well, welcome back to our conference. My name is Ima. I just kind of introduced myself in the last section, but just in case you are not here yet, I'm also delegate of the Taiwan Healthcare Youth Alliance, and it's my utmost honor to serve as your moderator for the second topic: empowerment in global health strategies, initiatives, and impact for youth. In today's global policy landscape, many regions are facing economic challenges and uncertainties, which can impact quality of life and access to essential services, especially for vulnerable populations. As members of the generation most affected by these challenges, what can we, as youth, do to make a difference? Maybe by engaging in civil mobilization, by raising more awareness and helping communities to understand these issues early on and take preventions, we can drive meaningful change as youths. Critical global health topics such as the continuous emergence of non-communicable diseases that should be addressed people-centrically, as mentioned in the earlier section. And we have mental health, health equity, gender equality, as well as youth engagement in health advocacy and diplomacy impact us all, and especially our generation. In this section, we have the honor to hear from 3 speakers who will share their perspectives and experiences on these vital subjects. Afterwards, we will participate in an empowerment workshop, breaking into smaller groups together with our speakers to brainstorm actionable ideas together. But before that, we will have a few honorable guests for the opening remarks. First of all, let's welcome our legislator, Wang, to provide a brief message.
Okay, all of 3 visitors from Taiwan. Dear distinguished guests, friends, colleagues, and especially the passionate young leaders from Taiwan and around the world. It is a privilege to join you at this important side event. As a legislator committed to advancing public health and youth engagement, I'm filled with pride, especially seeing so many talented Taiwanese youth actively participating in this global conversation. Today's theme, Youth Empowerment in Global Health, reminds us that lasting changes begin when young people step forward, not just as future professionals, but also present-day change makers. To Taiwan Healthcare Youth Alliance, I want to speak directly to you. The fact that you are here today, listening, sharing, and continuing shows that you are ready to take part in shaping the future of the healthcare, not only in Taiwan, but also on the global stage. Engaging in global health diplomacy, exploring the sustainable development goals, the building core competitions through events like this are not just academic exercise. They are vital steps toward building a more equitable and resilient world. Your curiosity, your courage, and your willingness to present Taiwan internationally speak volumes. And let me be clear, you do not stand alone. As a lawmaker, I am committed to creating more space for your voice, more support to your development, and more recognition for your contributions, both at home and abroad. So please keep asking both questions. Let the world know that Taiwan's youth are not only capable, but indispensable in global health. Thank you very much.
Thank you.
谢谢大家，谢谢。
Thank you to our representative of the Legislative Yuan, basically the Legislative Department of Taiwan, for being here and for your contributions. Next, we will also have two other honorable remarks from two doctors. First up, we will have Dr. Brian Zhang, the president of the World Organization of Family Doctors Asia Pacific region. Welcome, Dr. Zhang.
President Samuel, legislators, Huang Zhenxu, Huang Yuming, Liu Shuping, Ambassador Huang Weifeng, and distinguished guests, speakers, and participants. Good afternoon. My name is Brian Chen. I'm the Secretary General of Taiwan Medical Association, and I'm also the Asia Pacific Regional President of WONCA, the World Organization of Family Doctors. First, I'd like to extend my, sorry, it goes away. Okay. First, I would like to extend my warm congratulations to the Taiwan Healthcare Youth Alliance for organizing this meaningful and inspiring event. The youth were the driving force for the future of healthcare. We must remember that we were all once young and full of energy. Your passion, creativity, dedication will shape the next generation of healthcare and the public health systems. As we move forward, integrated and people-centered care is not just a concept, it is the future. Collaboration across multiple disciplines is essential for building resilient and equitable healthcare systems. Taiwan has constantly prioritizing innovation and inclusivity in healthcare. We take great pride in active participation of medical students and students from various healthcare professions in an event like this. Your engagement demonstrates that you care not only clinical knowledge, but also about global health, health diplomacy, and the future of our society. I encourage all of you to continue asking questions, building partnerships, and thinking beyond borders. Your voice matters. Your participation matters. Your leadership will matter even more in the coming years. Thank you very much.
Thank you so much, Dr. Zhang. And right now, we will have Dr. Ling for our next and last honorable remarks, opening remarks. Welcome, Dr. Ling. Oh, sorry.
Thank you, everybody. I'm happy to hear. My name is Dr. Henry Lin, and I come from the Taichung, Taiwan. I study otolaryngology
at National Taiwan University, and now practice independently. As work part-time at the medical center. More than 20 years, I follow Professor Li Zhenyuan in his effort to secure Taiwan admission to the WHO. I currently serve as the Deputy Secretary General of the Taiwan Medical Association. The Taichung City Medical Association has been sponsoring doctors and medical students to participate in Taiwan join the WHO all year round. And 3 students participated this year. It is a great pleasure to see this forum organized by the Young Medical and Healthcare with a focus on youth engagement, a truly valuable topic. Medical students today are the health leader of tomorrow. You are the future decision making who shape our health system and the public policies. The Taiwan Medical Association has also supported students involved in international affairs and values young empowerment as a foundation for sustained development. Forums like this, which bring together passionate young people from around the world, offer a meaningful platform for dialogue and mutual learning. They are key to build a more reliable and healthy global society. As we look forward to the second half of today's forum, particular of empowerment workshop, I encourage everyone to actively contribute to the exchange, the idea, and the discussion on public health policy. Wish you all are fruitful and inspiring today. Thank you.
Thank you, Dr. Ling. And we would like to actually have a group photo session right now because some of our guests are leaving really soon. So we're sorry for interrupting the session. It's upside down. Would everybody come closer to the middle of the room so we can have a huge group photo? Thank you so much for your understanding. The middle will be Thank you so much for understanding. Okay, now I'm very honored to introduce you to our first speaker of this section, Catherine Ulbarez, the current Executive Director of Health Diplomacy Alliance. Catherine is the founder and Executive Director of the Health Diplomacy Alliance, based here in Geneva. A former diplomat from the Dominican Republic, Catherine brings nearly 2 decades of experience in international relations, public policy, and multilateral negotiations, with a particular focus on health, human rights, and environmental issues. Throughout her distinguished career, Catherine has played a pivotal role in numerous multilateral processes, including serving as the focal point for national commissions, chairing the 2016 presidency of the Community of Latin America and Caribbean States in Geneva, and holding executive board membership at the World Health Organization. Now, please join me in welcoming Catherine.
Thank you very much. Thank you for the invitation. I'm quite excited to be here. Appreciate the invitation. For us, it's a pleasure as the Health Diplomacy Alliance, who you might have known, is a young organization, like most of us here in the room, a young organization based in Geneva who works in the intersection of health and foreign policies. And for us, it's a privilege because recently in September, during the United Nations General Assembly, we launched the Health Diplomacy Youth Network. That is a network that operates globally with many young persons working in the intersection of health, from the medical sector, from foreign affairs, working on what are the priorities that has been set by this working group, and especially bringing the voice of youth in all the global aspects and also at the regional level. It's quite important for us to be here to understand the importance of the participation of youth in health diplomacy. Why? Because we are living in a really evolving, fast evolving world. And it's, as I say, we are in a historical, we have to see this as a historical institutionalism, how that has been changed in the years. And we are at a critical juncture. And it is up to the young ones who are working on this field to be able to change and have the opportunity to change what we are doing at the moment. We are seeing a lot of changes in health, specifically across sectors and partnerships. We are seeing that new alliances are being formed. And why these alliances are being formed is because the world is changing and the geopolitical that is involving health is changing as a whole as well. We need to maintain health as a foreign policy, which I aim to pass this message here. The importance of cross-sectoral diplomacy collaboration at all levels, from track 1, track 2, and track 3 diplomacy, from top-bottom down to the inclusion of the work at the global, national, and regional level. We see a lot of challenges that youth is been working on, especially in trying to cope with the innovative financing mechanism and the work that is happening right now, especially in the global health architecture. We understand that there is opportunity for the youths as well to have regional platforms and bring alliance that will help foster the work and be able that youth is part of the conversations in all the processes that are happening at the global level. There are many aspects where youth has been really instrumental in changing movements, and climate change is one of them. Not only climate change, but also in governance reforms. We see right now we are at the parallel of the World Health Assembly, an assembly that is unprecedented changes required, where we see a process of possible reforms within WHO, not only from the financial aspect of the WHO, but we also see it from the perspective of governance within WHO. And youth has to be part of this part of the conversation. I would like to finalize saying that I encourage all of you to really bring this alliance, foster these collaborations, and form this alliance with other youths that are working at the global level to really elevate health diplomacy at all contexts, and to also navigate those geopolitical complexities that are happening right now in health diplomacy. Thank you very much.
Thank you, Catherine, for your insightful speech. And right now, our next discussion will be exploring gender discrimination in public health measures in the society, highlighting the advocacy and mobilization of communities to better the conditions of females. Vivi Lingwei is a renowned social activist and founder of the nonprofit With Red, dedicated to advancing menstrual justice and youth empowerment in Taiwan and globally. Since 2019, her organization has reached over 1 million people, pioneering projects like the Period Museum. Vivi is a passionate advocate and for period positivity and gender equality. Please join me in welcoming Vivi Ling as she shares her insights on empowering youth and advancing equity in global health.
I'm a tiny person, so I hope you guys can see me. Good afternoon, everyone. My name is Vivi. Thank you so much for having me here, and thank you for the introduction. So as I mentioned, I am a human rights activist. I mainly work in the gender space and menstrual justice space. So in a nutshell, everything related to menstruation is basically my battlefield. And I founded an organization called With Red, and I also founded a physical museum. It's the only period museum that's currently exists in the world, and it's located in Taipei. So before we dive into the projects that we're doing, I kind of want to talk a little bit about what exactly are we talking about when we say menstrual justice. So last year, actually in Geneva, exactly the same place, Human Rights Council, United Nations Human Rights Council, actually include menstrual justice as a fundamental human right in a really remarkable resolution in 2024, stating that menstrual justice is a fundamental human right that all governments are obligated to try to protect every single citizens of their own to have this right. And when we talk about menstrual justice, it's actually an umbrella term where there are a lot of different issues related to menstruation is included inside. So including period poverty, which is basically a lack of access to period products or wash facilities with dignity. And that can have an impact on people's physical and mental health and a holistic well-being. And if you look at the statistics coming from World Bank, we actually see 500 million people across the world currently still experiencing period poverty. And it doesn't just happen in lower or middle income country, but it also happens in a lot of high income countries, such as, for example, in the UK, where I'm based now. A lot of students, in 2019, there was a survey saying that 140,000 students actually missed school because of lack of access to period products. And it happens in Taiwan as well. So when we started the organization, there was no research in Taiwan about period poverty. So we did the research ourselves. And then we realized that there were actually 9% of people in the menstruating population in Taiwan are experiencing period poverty. They're facing a dilemma between choosing to buy period products or other essential products on a monthly basis. And it's quite similar to our neighboring countries. So if you look at Japan, they did a research during COVID, and they discovered that there were around like 8% of people, the menstruating population, who are experiencing period product. So what I want to say, period poverty, what I want to say is that it doesn't just happen in a lot of countries that we intuitively might think of, but it happens everywhere around the world. So it is something that we need a collective action to solve together. And there are also other topics such as period stigma, period shaming. This is also really important when we talk about menstrual justice. It affects every single one of us in this room and on this planet. And as we all know, half of the population menstruates, so as long as you're human beings, period is an issue that we need to talk about more. There's also a problem with lack of access to period products in public spaces. As we can see, more than half of the people actually face that problem when they go outside in Taiwan, and actually 90% of the people told us that they've experienced needing to borrow a period product from someone else when they're outside. So next slide, please. That means there's a lot of things to talk about. But before I dive into the projects that we do, I kind of want to share a little bit of stories about why I chose to focus on menstrual justice. There's so many issues around the world that youth care about in the current era, especially where we're basically living in a very challenging era and time. But why did I choose to focus on menstrual justice? The story actually starts when I got my first period. So when I got my first period, I didn't know it was period. And I was just really scared. I thought something was happening to my body. I thought I was sick, and I didn't know who to talk to. So I tried to hide whatever that was happening, the tissue paper and whatever things in the bin. But my mom discovered that I was having my period. My mom is a really outgoing person. She talks about everything openly. But when she talked to me about period, she didn't use the word period at all. So I got really curious. Why couldn't she use the word period to talk about period? And then I went to talk to a lot of more other people about period. I was talking to my grandma. I cannot forget this experience. When I talked to my grandma, she basically looked at me and say, you should not talk about period in public places. That just got me more curious. So since then, I dived into the period world and did a lot more research on period and became a menstrual activist. But I always thought it would be a side project. I never thought it would be my full-time job that I do right now. Until when I studied in Edinburgh as a student studying medical infectious diseases medicine, I was very curious in seeing how Scotland, there were so many people marching on the street trying to pass a law, which is free period product law. Eventually it became the first legislation across the world to mandate free period products in public places. And then I was in my dormitory thinking, if there are so many people in Scotland that can gather together just to pass one law to ensure everybody have free access to period products, I'm sure Taiwan can do the same thing. But it needs to start somewhere. So after shower, I was sitting in front of my laptop thinking, what do? I really want this to happen. I don't know how can I get it happen, but I just want it to happen. So then before I dried my hair, it was literally so cinematic. I was sitting in front of my laptop with my hair wrapped in towels, and then I opened up a Google Drive. That's how I started my organization at the age of 21, and it's now the first organization in Taiwan promoting menstrual justice, but also one of the most influential one across the world. And yeah, that's my story, becoming a menstrual activist. Next page, please. So since then, we've been doing a lot of different projects, as you can see on the slides. So the first thing that we did was basically period poverty has always been a really important project, a really important issue that we want to tackle. So we started by doing research about what period poverty looks like in Taiwan and how we can better support people who experience period poverty. Now we actually send personalized period product packs to people who experience period poverty in every single city in Taiwan, including the outlying islands. And that's kind of like the support system that we've been doing. We actually designed the whole support schemes where a lot of different social organizations can also adapt, and we work with more than 50 organizations across Taiwan to do this support work. And we all know that there are a lot of things happening in the past 5 years. There were happening, there were natural disasters, and pandemic also happened in the past 5 years, right? COVID, we still have a really fresh memory about it. And period won't stop. Even if these things happen. COVID was there, periods was also there. But this is something that people often forget. One of the things that I discovered during COVID was that in the emergency management plan across the world, period is not included. So we do not, most people do not think about period needs when they think about emergency response plan. Meaning that when people are locked down in their room, it is very, very possible that they're experiencing period, but they do not have access to period products. So that's when I started to advocate for every single country, and I started from Taiwan to include menstrual needs and menstrual product in the emergency management plan. And then we eventually succeeded. So when we collaborate with the Ministry of Foreign Affairs on supporting, sending humanitarian aid to Ukraine war, to people who were devastated by the war, they actually include menstrual products. And it happens the same time, it happens as well when we were sending humanitarian aids to people who were devastated by Turkey, Syria earthquake, and also Hawaii wildfire, and many more. So that's another thing that we've been doing on to ensure that when we talk about emergency management plan and humanitarian aid, menstrual needs are included. Another thing that this is something that's my personal favorite, which is I actually come from a family where my parents all work in education. So growing up, I always tell myself I would not work in education. My dad was a teacher, and then he was always like, oh, he has so much passion in education. I was like, okay, so this is an industry I don't want to work in. But then when we work on menstrual justice advocacy work, we realize that education is an intrinsic part of the advocacy work. We have to work on education. Because imagine if the first encounter to menstruation, you do not have any bad image or impression about menstruation, then menstrual stigma would never be formed. Then we would not need to work on tackling menstrual stigma. So I eventually had to dive into education, and we actually did, we work on the basis of the current curriculum, but we reformed the whole system of how we teach and how we talk about period in schools. So we designed and published several books and educational materials for a lot of different teachers from primary school, secondary school, to universities in Taiwan. As you can see from the introduction slides, we also co-introduced a general sort of course, accredited course in the University of National Taiwan University, where you can take a course named menstruation for a whole term, and you can get a credit from it, and you can learn not just about menstruation, but also how to do activism work. And now our educational material is currently used in more than 150 schools across Taiwan, impacting more than 300,000 students and parents and teachers. We're working on making sure that every single school in Taiwan can access these educational materials. There are also other projects that are much more broad on the spectrum. So we realize that you can not talk about a social issue simply tackling it from an educational policy or a social welfare perspective. You also have to sort of tackle it from cultural and other social perspectives as well. So we did a cultural project with a lot of grannies to documenting down their period stories, because it's a really important part of the woman history, and we know that if we don't document it down, they've never talked about period to anyone else. And that means if they pass away, no one will ever know in this world. And that actually inspired a lot of different countries to do the same thing now. So we now see more and more people are talking to their families and documenting down that part of the history. We also hosted an exhibition a couple of years ago in Taipei, which was the biggest menstrual exhibition across the world in history. We hosted that in a 330-meter square exhibition hall with 16 different themes of period. And as you can see on the picture, there were a uterus castle. Basically, people can jump into the uterus and just have a really fun and interesting impression about period from their first sight. And then these kids, imagine them growing up. When I think about period, it won't be something as stigmatized as what we currently experience. There's also some cultural, religious perspectives. So a lot of people believe that when you're on your period, you're not allowed to enter temples. And so we started collaborating with a lot of temples, trying to find the root cause. And now we see a lot of temples in Taiwan actually have a poster in front of the temple saying that we welcome everyone who menstruates to come into the temple whenever you want. Next slide, please. So that's kind of like a different, some different approaches that we've been using to promote menstrual justice. And some projects that I really want to highlight, one of them is the Period Museum. So I didn't just wake up one day and then be like, I want to build a museum. It's quite impossible for someone like me coming from a humble background to want to build a museum. But I started this because when I started working on menstrual justice, I realized that a lot of people who do not support menstrual justice is not because they have a strong opinion opposing it. I think it's really similar to a lot of a wider sexual reproductive health and human rights issues. It's not because they have a really strong opinion opposing it, but because they've never actually had an opportunity to have a conversation or discussion related to it. So I was thinking, it would be so great to have a space to just talk about it. And that's how we can destigmatize and desensitize a lot of issues and then to push forward something together. So then I started talking about it to a lot more people. And after 3 years of advocacy work, we managed to actually gather more than thousands of Taiwanese people donating us with small donation, and then we found this Period Museum in Taipei all together. And now it's open every Friday to Sunday, free entry for everybody. So if you ever have a chance to visit Taiwan, we were more than welcome to welcome you at the Period Museum. Next page, please. And we're really proud to say in the last 2 years we have this museum, we have actually more than 10,000 visitors coming from 30 countries coming to visit us, and 40% of the visitors are actually people who do not menstruate. So this is something that I think we really serve the purpose that we wanted to build that museum, is to have that conversation. And we do see a lot more conversations happening, not just in the country, but also across the world. We see a lot of politicians, decision makers coming to Period Museum as part of their visiting plan, saying that what can we do in our country, what kind of policies can we make in our country to make a change, especially not just from the neighboring countries, but we also see a lot of people coming from Europe and from the US coming to visit to see what they can do in their respective countries. Next page, please. So there's another project that I want to highlight, which is a period-friendly space. This is kind of more related to the public. We want to find a way where public can participate. I think this is a really important part of advocacy work, is how you can participate really easily. And so we started this project called Period-Friendly Space, where people who own a space, run a space, they can get certified if they provide free period products or wash facilities, freely accessible for people. And they can just come into, they can apply for this certification. And once they get it, next page, you will see the sticker in front of like the counter, or a lot of them put it in front of their front window. So you will see actually a lot of spaces in Taiwan, when you enter the space, you see that sticker and you know that you can access these services freely if you enter that space. Next page, please. And so far, we actually have more than 600 spaces that got certified with this certification program. And we're proud to say we actually pin all these spaces on a freely accessible map incorporated with Google Maps. So as long as you have Google Map, you can add this map to your Google Map, and you can find the peer-friendly space that's nearest to you. And we actually have more than 2.5 million users using this on a daily basis now. So a lot of, we've seen so many reels and short videos on different kinds of social medias. There's a lot of people who visit Taiwan and they didn't know where to find toilets. It's like the basic need people need to access. And they say, thank God there's this map so I can find somewhere that I can go. And they're like, that gives them a really good impression of visiting the country. And I think this is really important. So we're trying to expand this project to make sure that it's not just in Taiwan, but everywhere across the world. Next page. The last thing I want to share is that we all know that there are so many things that civil society can do. But if you want to make a sustainable change in every single society, one thing that you definitely have to do is to collaborate with the government as well, because there are so many things that we need to change in the policy in order to make it accessible for everyone. For example, the education. We do believe that we cannot go into every single schools or family to interact with them. And we do want every single children in Taiwan, regardless of their background, they can all access the same kind of quality of peer education. Oh, and I forgot to say, the peer education that we do is gender inclusive, meaning that from the very beginning, we invite everybody to participate in the educational workshop, regardless of you're a girl, you're a boy, regardless of your background. We invite all of the people to participate. And one thing that we're really proud to say is that in 2023, Taiwan actually became the first country in Asia to mandate free peer product on all campuses in Taiwan. So now every single school is obligated to provide free peer products to their students and people who work on campus. However, since the implementation is still ongoing, so we're doing a lot of evaluation project on it, but it's still something we're celebrating. And we're using this experience to really share it to a lot of global partners and advising different global governments to see how we can all do better together. And there are also other policies that have been changed in the past few years on the local level and also on the national level. We're still pushing forward some more policies that are related to peers, such as ensuring that peer education is in place, ensuring that there is more public places that have peer products, not just schools, but also, let's say, cultural centers or sports centers, because no one wants to go and watch football and then needing to leave the football stadium because they're on their period, right? So this is something that we're working on right now. Next page. And the World Economic Forum, which is headquartered in Geneva, they actually mentioned this in 2019, saying that it's great that people are trying to make peer products freely accessible, but we need more than that in order to end peer poverty. And then in the next couple of years, a lot more research is actually gathered to say not just about peer poverty, but also about peer stigma in education. We need a lot more than free peer products to end all these issues and to make sure that peer equity is a reality for all. So the last thing I want to share, next page, please, is that from the very beginning that I founded this organization until this moment, and I'm pretty sure it will continue, is that I believe menstruation should never be a barrier to people's opportunities or choices and well-being. And I will continue to work on this, and I'm sure this will be realized in my lifetime. But I will continue to work on this until we're no longer needed, meaning that menstrual justice is a reality for all. That's all I want to share today. Thank you so much for having me here.
Thank you so much, Vivi. I would just like to echo that I do feel the same thing, that we don't talk about period at all in household. Not talk about like your underwears or anything. You should not show them anywhere outside your bedroom. And if there are visitors, clean your bedroom. Nothing should be there because visitors might open and see. So yeah, we all very welcome you to come to Taipei, come to Taiwan and visit all the amazing museums, including the With Red Period Museum. Okay, so, and here we are with our final speaker today before our empowerment workshop. Wait a second. I don't want to have your name here. Just to, yeah. Okay, so Federica Castellana is a dedicated public health advocate, currently serving as country delegate for the Italian Red Cross and secretary of the Young Working Group at the World Federation of Public Health Association, or WFPHA. And since November 2023, she has led the Young WFPHA Working Group focusing on youth engagement and global health advocacy. Federica has collaborated with several student and young professional organizations, including the European Public Health Student Association and the WHO Society. In 2024, she represented WFPHA at the United Nations General Assembly Summit of the Future, drawing on her diverse academic, professional, and volunteering experiences. Federica brings strong organizational and leadership skills to our missions of advancing global health and empowering the next generation of public health leaders. Please join me in giving a big round of applause to welcome Federica. Thank you.
Okay, yes, of course. Okay, perfect. Thank you. Thank you so much, and good afternoon, everyone. And thanks to the Taiwan Healthcare Youth Alliance for the invitation and this opportunity to speak. And thank you also for to the previous speakers. I, as a missing presentation, thank you so much. I am Federica. I'm the country delegate for the Italian Red Cross. But as a disclaimer, everything that I will say in this presentation does not represent the vision of the Italian Red Cross. Next page. So I was thinking while I was preparing this presentation, what should I talk about? And this is an event about global health diplomacy and youth empowerment. And so I just start thinking and reflecting. And I wanted to bring to you today my experience, my professional and volunteering experience, more as an example of the engagement that I had to experience and my experience on the field, hoping then to or inspire or people can also see what my professional experience on the field is. So I'm going to talk about youth advocacy at the Young World Federation of Public Health Association, about community engagement and empowerment. Next slide, please. So this is really quick about me. After graduating in physiotherapist, I committed 1 year of volunteering services in Tanzania, where I actually started to know the power of community-driven work. After that, I actually moved to Tanzania and lived there for 5 years as a project manager, where I had to experience the complexity of public health in action. And that actually brought me to pursue a master's degree in European public health. And I had to really learn all the theory and the framework beyond public health and the governance and system thinking and diplomacy. And that actually helped me a lot and never put me away from the field, but actually gave me more motivation to say, okay, I want to come back and I want to see myself and who I am right now with all the knowledge of the master. Next slide, please. And as I said, right now I'm based in Djibouti. I will say because the first time I heard about it, I actually didn't know about this small country is in the Horn of Africa, between Eritrea, Ethiopia, and Somalia, just in front of Yemen. So that is where I live and work. But I also wanted to say that continuous learning is a fundamental part of my journey. And I wanted to bring to you these 2 example online courses that I finished, and I'm currently enrolled in the Global Health Diplomacy course at the Lana School of Public Health. If you are interested, I think these are actually good opportunities to learn and to take more knowledge. And for me, it's really important because I realized that helped me then improve my work on the field and really be able to see the differences in the activities that I manage or in the activity I support implementing. Next slide, please. So I wanted actually to include these two pictures that are from a very important moment in my professional experience. This was in Tanzania. It was an advocacy event that we organized. I was working in community-based rehabilitation program, and this was for the International Day of People with Disabilities. And I really think it represents what I wanted to share with you, so that what I experienced is that transitioning from theory to practice is not just applying a model that would learn, okay, there is a model, we have, you know, how we can implementing a project or an activities. Is not just that, is really building relationship. And what does mean? It really means to put the community in the center and to really empower community. And when we say empower communities, I think sometimes it's easy for us. We need to then develop a project and we need to include the community at the center, but then what does it mean? For me, what it meant in that occasion, and then during my daily life at work, for example, this event, what you see speaking is actually the father of a child of person with disability, because were the parents of children with disability the protagonists of this event. They were the one that helped in organizing the event. They were the one that designed the events. And that is one example of really thinking of translating from theory to practice and then engaging with the community. And of course, participation and content-sensitive strategy. Next slide, please. And the picture here, I'm just going to explain because the context changed. This is actually one of the activity of the project in Djibouti, and I wanted to share this picture because I also think it's nice then to see different environment. And this is one of the activity of the mobile unit life-saving assistant to population on the move. And what I'm speaking in my work right now is that when you have to having partnership and work with international organization, with the community again, with the national institution, you really need then to be able to use all the system thinking that you learn and the diplomacy. And I reflected a lot, and while I was doing this presentation, about the stakeholder analysis. I think that all of us, while we were studying, we had to do the stakeholder analysis and then have to map interest and influence. And at one point, I remember last year, I finished my master last year, I was like, okay, yeah, let's put this and this and this, because this person is important, that this institution is important. Of course, we put, again, the community in the middle and the media. But then when you are managing and implementing an activities, and you really need to go and talk to an international organization, to the organization of, for example, the UN, for the government that has different priority, and then really to the community and to the beneficiary of your activity that are actually migrant on the road. That is really when you start reflecting on importance of what does it mean interest, what does it mean influence, and then putting in practice. And what is really important is then being able to translate policy into services on the ground. That is not just sometimes also a translation in languages, because for example in Djibouti they speak Somali, and so it's also actually very difficult then to translate English, French, Somali, and you just go across 3 languages. But it also, I think it was mentioned before from the previous panel, Dr. Padmin, it really means to make a language that is easy to understand. And is my role is basically, I know what are the policy of the country, I know what is the policy on migration and health, but then how can you translate of the policy, how you can tell the community what is this policy about, what are the rights of migrants, for example. So that is what it really is complicated sometimes, but that is what the work is, really being able then to transmit your message and to work then with the community, with the beneficiary. Next slide, please. And yeah, I'm just gonna repeat a little bit. This was also another picture in Tanzania. It was a meeting that the local staff organized with a community. It was I think 3 hours from one of the main city, so like remote community, and we were discussing on how actually we could implement the intervention. So really listening to the community before deciding how you are gonna implement a project, and in this case, health project or in general any topic. And when you are able then to transfer the knowledge, it really becomes then action, and you are able to have sustainable solution. Next slide, please. Just again to explain, this was actually recently we were invited to a house of a person that used to live near where volunteers of the Red Crescent in Djibouti was working, and they wanted to talk with us, and they were like, welcome to our house. We actually want to talk to you because we saw that migrants have this need, and we would like to know more about it. And I was there, and I was reflecting, and for me, what was really important, and the message that I wanted to give to you today is that we can have the knowledge, we can know the policy, we can know the framework, but then real community engagement really means be able to make a step back and say, okay, I have all of this, but the knowledge of the community, the need of the community is what really matters here. And it what really make you having, as I said, the solution that can benefit everyone, but it really puts you in a state that you are aware of your limits, you are aware of your bias, and you say, yes, this is also a cultural matter, because of course this is completely cultural difference from the one in Italy, but community in this situation and community knows better. And even if I'm a public health professional, even if, again, I know which framework to use, the need assessment, and I can assess the vulnerability of this community in 3 different ways, and I know when the community come to me and talk, that is what matters. And that is what I mean when you need to build relationship, and you really need to be able to be in the same house, in the same coach, and listening. Okay, yes, I'm here, I'm listening. And when I say also we, is that in this picture you see a lot of white person, but usually I'm the only one because it was a mission. But in this room, it was not just me as a project manager. There was the field coordinator of the local association, but there were also the volunteers of the Red Crescent that every day work in this project, because they also need to be there, and they need also to express their opinion and their view on the activities, and also their experience on engaging with the community itself. So this is what I mean when it's building relationship and engage with all the community. Next slide, please. And I also wanted to bring just a quick slide on the gender perspective, because right now it does not happen. I'm working in a space where all the leadership is female, but in the past in Tanzania, it happened that I was the only female and the only woman, and also sometimes the youngest in the room. And I'm not scared to say that it was not easy, and it was not, I don't know to say, like, maybe I did not have the same confidence I have today, even in my professional, in my personal life. But I always reflect on what I could do. It's like, okay, nothing will change. Like, I'm the only woman. What is it matter is I have a child, or if I'm married, because that were the question that was asked me. And it was really frustrating. But then I was like, no, I want to use that really as a power, and representation matters. I am a woman and a young woman in the room speaking with a lot of people. It doesn't matter. Like, I'm gonna fight, I'm gonna study, and I want to know what can I do, and what is the way to approach people to actually, like, first for me, not to feel afraid, and not to feel afraid to be in the place where I should be. And again, representation matters in any case. In this case, it's about gender, but I'm gonna say it again because it really matters. And I am for inclusive voices and inclusive system, for first system and lasting change. The next slide, please. So, yes. Perfect, okay. Yes. And I wanted then to bring to you today my experience with the Young World Federation of Public Health Association. And for me, youth leadership is not just individual power, but it's collective power. And this is what we do, what I really feel that we do within our working group. And we are individual that we have shared goal, shared aspiration, and I really believe that this is also what helped me a lot in my fieldwork when things are more difficult, like besides like motivation and like the being far. This is what really allow me then to reflect on the power of youth, on the power of leadership, on the power of advocacy. Next slide, please. Okay, yeah, so just this is an overview on the working group. So the vision of the Young World Federation is to empower, engage, and aggregate students and public health professional, early career public health professional to increase international collaboration. The aim is promoting opportunity, exchange of knowledge and best practices, and then empower early career public health professional worldwide. Next slide, please. These are all the key focus area. I'm not going to mention everything, but I would more to do some example of activity that we did in the past few months on youth empowerment. Next slide, please. Before that, this is our structure, and I wanted to share with you because I think that this really show how we work and how we want to work also in collaboration. So we have the management and performance team, but then we have a research lead, and we are currently have research on emergency preparedness and the primary healthcare, including other research. We also have a team in communication. We have also is a new team on education because we really want to strengthening our capacity building for young professionals. Then almost new team in fundraising. We do activity and engagement with our members, but also we focus on network. And then we have various partnerships. These are just some of them. And we have a representative in the Emerald Youth Council and also representative in the MHR quadripartite group, young group. Next slide, please. And as I said, these are some of the activities that we organized in the past months. There is the list of events that we organized for the Global Public Health Week that is led by the World Federation. And that is actually an example of the collaboration that we create in the Young World Federation. We organized various webinars on different topics. It was planetary health, MHR, decolonization and equity, digital health, gender and migration with various partners and various associations worldwide. Last year, for the Global Public Health Week, we organized a webinar on empowering future public health professionals, and with other youth organizations, we draft a manifesto on youth empowerment. This year, we continue the dialogue, and we organize a webinar on decolonization and equity in public health, but again, bringing youth voice. So we had a panel of young people to discuss about matter. And we also launched last year an educational activity called Health Hub, a communication platform where we would like to, we want to have video and reel and using social media to create content from young people to young people and discussing public health matters. Next slide, please. And I wanted also to present to you some future activities. We are strengthening and officially forming the Global Youth Network of Public Health Association. We aim to create a network where youth branches of Public Health Association or youth-led association can be together in the same space to increase the collaboration, the knowledge sharing, the peer-to-peer learning, and then promote the organization of webinar or event together as the one that I was showing before. We are currently, as I was mentioning, strengthening our education, research, and fundraising team. So we are in this moment trying to expand and include more and more people in our group, because of course we need then people to do all the work that we would like to do. Then we are also working on organizing a side event for the high-level meeting at the ECOSOC Forum, at the ANGA 80, and also at the World Deaf Summit in Berlin. And we're also already starting organizing the ISMO, the International Student of Public Health event in September 2026. That is part of the Congress that is organized and led by the World Federation of Public Health Association. The next one in September 2026 is in Cape Town. And as a student and young professional, we aim to have an event just for young professionals focusing on capacity building and teaching and learning public health, and having a panel discussion about leadership and about topic as the main topic of the Congress. And the Congress is organized in collaboration with THYA. Next slide, please. I also wanted to show you our delegation for the World Deaf Assembly, because you may see our team during this week in Geneva. So I thought it would be nice to show you, and I invite you to see them, to contact them, maybe to take the name. If you see on the room, you can talk and ask any question. We're really here to make as much network as possible, and we really invite as many possible to join our team, because as I said, we really are together, and we really believe in the collective power of doing things together. Next slide, please. And before concluding, I wanted just to reiterate that what advocacy and activists mean to me, and everything that I put in my work, but also in my volunteering activity with the Young World Federation. Activism is really the daily work of building spaces to shift policy, and I really experienced that creates solidarity between borders. And again, I would say that advocacy becomes transformational when it's collective. And as I was saying before, it's not always easy to have your motivation high, because like things happen, and maybe you do something and you don't have anything, you can see the impact, you don't see the result. And this is what we do in the Young World Federation. We give each other strength and motivation. Next slide, please. And to conclude, I created this collage because I wanted to bring to you today, as I said, also the diversity and the collaboration that we have. These are some of the people that collaborate in the Young World Federation. And as a message to you all, Houghton or not, I really want to say, don't be afraid to use your voice, and your voice, our knowledge, our value, our community are already a force for change. Next slide. Thank you so much.
Thank you so much for the inspirational speech. I noticed how the sky just lightened up when we talk about the collectiveness, when we talk about, so it was amazing. Now, I'm very excited because I come up with the idea, but right now, we're going to start a youth empowerment workshop really soon. But we will have to rearrange the seats a little bit, because we'll try to divide into different group discussions. So would you kindly please leave the room real quick for like 5 minutes, and we'll see you very soon after we try to rearrange the seats. Thank you so much. Make sure to come back. And we also have some Taiwanese snacks that we brought. It's our favorite, so make sure to try them when you're out there. Yeah, thank you. Also, bring your friends here if they're interested. Next one will be really good. We'll actually network with each other among the youths. Okay. Welcome back, everyone. Would you please try to find whichever topic that you're interested in and just sit down. We have 6 different topics around here, and you can just maybe find a speaker that you just listen to and you're interested in, or maybe just if you want to stand, you can stand. If you want to sit, you can sit. May I have my PowerPoint on? Thank you. Yeah. Essentially, we will use these topics and try to find some advocate ideas for youth, as youths. So, okay, continue. Everybody, please come in. We're gonna start really soon, in 2 minutes. Let's make it 4:25. We'll start then. Thank you. I see that for human rights, with a focus on sexual and reproductive health here, we still have a few slots, if anybody's interested. And also for the PhD essential health systems over there. Yeah, try to spread around. Yeah, I know you guys have a lot of people here, so you're good. Okay. Thank you so much. Cool, cool, cool. Okay. Okay, let me start now. So for the second part of this section, we'll have the empowerment workshop. And I'm Ima, if you haven't remembered yet, and I'm the moderator. So next place, please. We're gonna try to use one focused question with what can youths do to make more people care for global health? And we'll try to use all these topics around. If you have some experiences before doing youth advocacy, maybe you can share your experiences then. Maybe you're in academics, maybe you write something. We can try to reflect on what we've listened throughout the session today on maybe health literacy, how to do better health education, how to mobilize more people, and using this focus question. So right now we've already broken into the small group discussions, and we will have these youth facilitators from our Taiwan Healthcare Youth Alliance, the people raising their cards. So for the people just joining, you're welcome to join any of the desks here with different topics, if you guys want to join. Okay, cool. And then we will have the guest facilitators that I just mentioned. So please take this opportunity to build connections and learn from each other during these next 40 minutes. And after that, one representative from each group will share their thoughts or among your discussions. And we will have approximately 90 seconds to 2 minutes to share the perspectives after the 40 minutes discussion. So next slide, please. I've prepared a few thoughts. Well, basically, we've talked about all of these earlier. Next slide, please. I've only shared this to perhaps give an idea. Maybe we can try to analyze a problem that we have on this topic right now. Maybe why is global health or public health so distant to people? Or maybe are there some misconceptions going around? And then we can start about some ideation, try to make it more specific and maybe actionable for youth, and potentially it's higher impact. And then we can share our experiences after the discussion concludes. Next slide, please. So yeah, basically these are more ideas, and these are all the topics we have today here. And right now it's 26th. Maybe let's start now? Okay, let's start a discussion. Yeah, 40 minutes. We'll try to put on a time countdown. Okay, thank you. Yeah, introduce yourself to each other as well. Friendly notice, 15 minutes less. 15 minutes. Ten minutes left. 我应该直接下去问，对不对？
Ding ding, less than 5 minutes. Be sure to pick a representative or two. One last minute. Time's up. Are you guys done yet? Done? Sure? Okay. Or one more minute? Okay. Do you guys need one more or 2 more minutes, or we can start now? Okay, they're still discussing. Okay, maybe. Hey, 1 more minute. Okay. 1 more minute and we'll start. 1 more minute. Okay, last 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, time's up, people. I hope I can join you, but we have to sum it up. Okay. Finished? Okay, no problem. Thank you so much for the energetic and passionate discussion, but we have to sum it up right now. First, let's welcome our first group. I believe, yeah, to share your discussions. Purple one. Okay, it's working now.
Okay. Yeah. Well, so our topic is NCD prevention. So yeah, we divided our discussion into 3 parts. The first part is problem analysis. Okay, so we kind of identified the risk factors of several NCDs. Yeah, you can see like CVD, cardiovascular disease, and cancer, COPD, or say some dental-oriented like periodontitis. Yeah, so so for this kind of NCDs, we have different risk factors like tobacco use, alcohol use, or high sugar intake. Yeah, and the second part is how do we plan our prevention, right? Okay, so actually there are many aspects like health promotion, health behavior intervention, or like the topic we have covered earlier today, digital health intervention.
30 seconds left.
Okay, policy. Okay, well, I'll be quick. Policy implications, and we have several actions like monitor the amount of sugar intake, health condition monitoring, and in collaboration with governmental departments like Ministry of Education and police office to implement the laws. Yeah, so yeah, basically that's it. Yep.
Awesome. Okay, thank you so much for your experience. Now let's welcome our second group. PHC system. Okay, cool.
Hello. So our group are going to discuss about the health system, and it's quite complicated issue. So actually, in the beginning we talk about the healthcare system in Switzerland, India, and Taiwan, and we also have the insurance covered. But we mentioned about the difficulties in 3 countries, like we face the shortage of workforce, the limited budget for the healthcare, and also we mentioned about the brand name and generic name issues. And also, as we know that we have more resource, but we still face the challenge of that not every patient can access the healthcare. And so when you talk to the youth engagement, we are thinking about, health system is really complicated. So we think maybe we should change the regulation to deal with the difficulties. But when we go back to what we can do as we are the young generation, and we think maybe we can have some certain percentage representatives in the government, and we can participate to be a part of policy makers, and maybe that's a way, but I'm not sure. Do you have any ideas? But we cover a lot aspects about the health system, and it's really hard to change in this stage, but we are moving to do something. If we start to do something, we will go there in the future. Yeah.
Awesome. Thank you so much. It is indeed hard. Okay, now let's welcome our third group to share their discussions. Be careful. Yeah.
So our group is talking more about the healthcare advocacy and health equity perspective to let more people know about global health. So basically what we're trying to do is, the first thing we talk about is advocacy. So what we think about is how to let the youth be here. This is a question because we are from bottom up to do the decision-making work. And turns out we find like the innovation work on the social media or use the tools that we really good with it is one of the way we can trying to do. And also the peer-based learning together and also trying to pop out new ideas is also helpful for the health advocacy work in during our discussions. And for health equity, we have shared our own experience about like doing the volunteering work or work in student associations and so on. And we find out like one of the way we can increase the health equity is during the volunteering work, we can bring the service and also the knowledge together to the place so that people can learn more while getting the service, getting the health service. So that's all we have.
Okay. Thank you so much. Okay, we'll take a picture of that. I was thinking that it was not clear enough, but it's okay. Okay, now let's welcome the fourth group. Wow, love this board.
We have to stand there. So we were the group about, what was the name of our group? Community.
You don't have to come here, actually.
Community mobilization. So we are going to implement this in our presentation and mobilize our entire community. So I will start by presenting and then everyone will take over. So we basically drew a map about how to go about to attain the objective, which is sustainable change. So we start from global to local and really make the issue your own. And we want to start to be inclusive of the communities needs and by including the community in the process of thinking about how and we want to implement change. We want to also use humility all the way by taking into account cultural sensitivity, and we want to connect the issue to a personal interest and explore different approaches.
In addition, we have to also be very clear of our target audience so that we can choose the most appropriate media or platform that we can convey our messages. And then we also have to identify the need and what is the gaps between what we want to achieve with the current stages. And then also we have to provide very easy and accessible evidence so as to increase the literacy of your target audience. And then we can identify the champions.
So what the youth can do is to reduce the gap between the policymaker and to have the communications. So we have to change the those who have the power to change, like the policymaker and public health professionals and experts.
After doing this kind of difficult work and jobs, that because it requires a lot of cooperation from different multi-sections from all over the county and also the community. So after that, we can make the change, and the key point and the essence of the change is that to maintain the sustainability of that so that the circle can continue to happen in the future dealing with different kind of health issues. And that is all about our presentation. Thank you.
Thank you so much. You made it in 2 minutes. Okay, so lastly, we will have our biggest group here, which combine 2 topics, so they will have 4 minutes. And yeah, feel free. Wow, this is a beautiful poster.
Where do we go? We go there. We go there. Okay.
Let's go.
So hi everyone. Our 2 topics were health rights, sexual and reproductive health, as well as international health organizations. So we decided to divide our 2 topics into 3 main ideas, so challenges, opportunities, as well as action.
Okay, so let's start with the challenges. We thought about some difficulties in reaching for people, for example, the decision makers and maybe the parents for our second matter. And of course, lack of correct education and reluctant to talk about, especially in the sexual and reproductive health rights, because the parents are mostly reluctant to talk about it.
So we also in the challenges talked about bias and stereotypes specifically regarding health rights, but also international organizations, and talking also about difficulties in reaching people, so especially decision makers and parents in both cases, which is important to implement change. Regarding the opportunities, number 1 thing would be elections. So we talked about the elections in Taiwan, but also other democratic countries. So how those situations can help youth talk to the people that are presenting themselves during the elections and ask for them to implement certain things and to have a vote in return.
Okay, so continuing with the opportunities, we thought about passing the youth voices to both elders and younger people, especially in elementary school, using partnership with international organizations. As the SDG 17 mentions, it takes a village to build what you want, and you should always collaborate. And of course, we need to fill the knowledge, especially in parents and maybe people with correct information regarding of both matters.
And to finish up on the opportunities, obviously youth uses a lot of social networks, so that is a big way to use that as an opportunity. And also a charter, so it would be implementing very simple and straightforward things that we want to change from the youth, and showing that to all the different stakeholders as well as the parents in the case of health rights. And to finish off on the actions, so we would start off implementing for the health rights some courses that would be available for children starting earlier than puberty. So we talked about the cases of boys, for example. It would be important for them to know about these issues before their puberty. Also having interactive books on health for ages 5 to 12 with pictures or different interactive ways to educate. And obviously open conversation.
Okay, let's continue to the action. As we mentioned, nothing is more dangerous than the ignorance, so we need to really focus on the education and raising awareness. That's why we can use platforms wisely, so we can educate the students and both the younger persons and the parents, as well as toolkits for parents. Not only for the young professionals and the children, but always for the parents too. And I think that was it. But you can add anything you want.
Okay. We just had, sorry, just want to add, we had just two last words that the speaker that was here that left a bit earlier, he said that nothing is more dangerous than ignorance. So yeah, just finishing off on these words. Thank you.
Wise words, wise words. Thank you so much.
Thank you.
That was an amazing amount of information and discussion that we all have right now. Okay, I am so delighted and so happy to be here and witness all of this. Today really showed us how young professionals in different regions can find creative ways to engage and lead change. We hope this workshop helped spark some new ideas and have some more new connections. Thank you all once again for participating. And I want to try to summarize what we have right today. I summarized into 2 points. Basically, the first one is to keep the motivation and keep it simple with all the advocacy work we're trying to do here. So we know it's hard from all of the speeches, the talks we've had right now. We listen to our different KOLs, like key opinion leaders, the guests, and inside our groups, we have experienced people sharing their thoughts and experience and everything. We realize that it is hard to keep motivated and try to keep doing what we try to do, whatever issue that is, wherever we are, and all of the regulations. It's hard to change the current world. It's just how it is right now, but we cannot give up hope. And we have to keep our consistency, whether you are inside your group or whether you're just on your own sometimes. Try to keep fighting. And the second one is maybe if we want to try to keep it practical, try to do something that you want. Try to keep yourself happy so you can actually keep working on. So, okay, I realize that it actually overlaps a bit with the first one, but wherever you are, whether it's in high-income country or lower-income countries, just try to keep all these communications going on, keep trying to do what you want, and I hope you have a memorable afternoon today. Thank you all so much, and we'll have a huge picture afterwards, but right now, yeah, thank you so much. Okay, so afterwards we'll have our Alliance's flag with us, and thank you all so much for spending this time with us. We really appreciate you so, so much. Yeah, and we hope you have enjoyed the rest of the WHA. Okay, so now, shall we just try to move into the middle? Oh wait, one last thing. Can we turn up to the last page? We have like one page for people to join. Oh yeah, we already finished that. Okay, we have a WhatsApp group, so feel free to join us and connect, our Instagram and Facebook. Yeah, okay, and then meanwhile, we can all step into the middle after doing this. Yeah, thank you so much. Oh, also bring your posters so we can share them. Yeah, and also, we actually have like 100 high school students online, so you're really inspiring a lot of people. Okay, okay, let's assemble.
Yeah, can everybody help me to assemble to the middle? Yeah, middle part of the room. Yeah, thank you guys. Can everybody just assemble to the middle part of the room, like really like in the middle? I don't think.
I'll tell them later.
So yeah, just move to this part of the room so that we can take a really quick group photo right now. Posters and stuffs. You can bring whatever you want. Yeah, to showcase whoever you are. This is all about youth and who we are. Yeah.
Sorry for the cold. I'll just show you really soon myself. But let's take a picture first.
好，等我一下。Okay, 3, 2, 1, yes. Okay, one more. Okay, 3, 2, 1. Let's see. Okay.
Thank you so much. We're gonna include him also. Yeah. Nikolai is our wonderful IT technician today, so thanks to him as well. Thank you. Yeah. Thank you so much. Thank you guys so much for joining us today. And the one for the WhatsApp group. 哦，对，没关系，我可以再把资讯传给大家。
I have to reach the beach front, which is two-way parking.
我可以借你一下吗？就想说，那个 Vivi 说她想要做一个小的访，可以帮高中生就是做一个小的访问。那、你们有没有顺便访问什么？我们可以一起。对啊对啊，就是小小的。拍不出来要不什么？没关系没关系，就是拍一个简单的鼓励小影片也可以。好，我觉得这样子还可以。不是摄影机。我知道。哎。